Without further ado, it is my very great pleasure to welcome Dr. Rappazzo to be giving us this talk today. Dr. Rappazzo is a researcher at the EPA. Before that, she studied everything from brain and cognitive sciences as an undergraduate at University of Rochester, to environmental and occupational health for a master's degree from Drexel, and then a PhD in epidemiology from North Carolina, Chapel Hill. So today, she's going to talk to us about her very cool research in eco-health benefits, getting from E to B and all the places in between. Take it away, Kristen.
All right, thank you, Nina. Thank you for having me. So I'm gonna go ahead and just dive into the presentation. And I will say the title was not mine. That was one of my colleagues who was much better at coming up with titles than me, because I'm just like, here's some stuff. All right. So to start with, these are my views and not the views of the US EPA. I used to have a Mission Impossible joke about this slide, and my boss told me that maybe I shouldn't do that when it's being recorded. So I'll just say it's there, and you can think of it probably. And so here's an overview of what I'm going to talk about. And I was calling it a timeline to approaching One Health, kind of. I'm an epidemiologist. I have a very human health centered focus, but it does involve a lot of stuff around that. So I'm going to start with a little background about the Sustainable and Healthy Communities National Program at the EPA, then going into some of the research we've done and what is the beneficial use impairments related projects, and some studies of birth outcomes research and hazardous sites into green space. And then I'm going to talk about the Sun Valley Greening Project, which I was not actually involved in, but is informing a lot of the work we are about to embark on or starting to put together. And then I have a conclusion with a question mark, because there's not actually a conclusion. It's just, and then we're going to do more things and try to figure out some more stuff. So the Sustainable and Healthy Communities National Research Program, or the SHC, because in the government we love acronyms, is about improving communities and built environment and removing contamination, also addressing these cumulative impacts, a lot of which involves environmental justice, as well as just having multiple chemical stressors co-located in the same place. And what they are trying to do in this program is to assess the benefits from remediation, restoration, and revitalization of contaminated sites, look at how these contaminated sites impact vulnerable communities and groups, and improve communities and individuals' ability to handle both contamination of sites that might be ongoing, as well as events such as natural disasters and other extreme events. And as part of that, they also want to be like, so is the EPA doing what we're supposed to be doing as part of all that? So that accountability, which will come in later. And so this is just a picture of a screenshot of the EcoHealth relationship browser. I am currently in charge of this. I've recently taken over from a colleague who had initiated it and retired a couple years ago. And it is essentially an educational tool that summarizes all the linkages between ecosystems, their goods and services, and then their health outcomes. So here we have the goods and service of aesthetics and engagement with nature in the center, and the input arrows in green are the ecosystems themselves, so forest, wetlands, agroecosystems, etc. And then everything that has a blue arrow going into it is a health outcome that has research linking it to the ecosystem good. And so that is going to come into play later and is sort of one of our conceptual pieces that we're going to be working with. So this remediation to restoration to revitalization, and again, love acronyms, so it's called R to R to R, is the process of going from contaminated to in-use space. So we have things like Superfund sites, which are highly contaminated. People shouldn't be on them, although sometimes they still are. And they're known to have potentially very, very bad health effects, and often also ecological effects. So one of the things that we don't like, we think obviously that removing contamination and improving the space is going to be good. We don't actually know if health benefits are conferred by that action, though. A lot of this is because that is often difficult research to do. These are like typically highly located or like very central located. So they might be a building or a couple acres. Some of them are bigger than that, but generally they're not like huge swaths of space, which is good. You don't want super fun sites taking up most of your state. Um, so we have these, if you were going to do a study, it's a small location. If you really wanted to do health outcomes research, you'd probably need to follow people over many, many years. So it's expensive, it's hard to do. So there hasn't been a lot of that done. We don't also always know what are the health benefit pathways. Is like if there are people who have experienced contamination and you remove it, are they going to improve? Is it going to be people moving in who are getting the benefit of not having contamination? So the sort of like, oh, so how does this work is also sometimes a question, often a question. And sometimes we also don't even have much research on if there is a detriment associated with the negative stressors in the sites. We think there is, and there's often like parallel research, so we can like be like, oh, this thing is bad and this thing looks like it, so it's probably also bad. But sometimes that is not the case, and sometimes we just don't know. All right, so that is some of the background. Then going into like the background of some of the research we've done. We have a project that's focused on these Great Lakes areas of concern and the beneficial use impairments that go into them. And so let's go here. The areas of concern are these locations highlighted around the Great Lakes, and this is both the US and Canada are involved in this through an international agreement. And some of these sites have been, this is, I believe, in the late 70s was when this program was started. Some of the sites have been remediated, some have had partial activities like to remediate, and some are just there and have not been addressed yet. And so these are designated areas that are usually located near population centers in the Great Lakes coastal zone, and they're degraded by legacy contaminants, including heavy metals and persistent organic pollutants. And then for each of these, there are 1 to 14 of these beneficial use impairments have been assigned, identified. Identified is probably the better word. So here are just the beneficial use impairments. The groupings are a thing they're not part of the actual beneficial use impairments themselves. But you can see there's degradation of aesthetics, impacts on fish, impacts on recreational activities, and some like down at the bottom, because again, I and my colleagues ranked these for our purposes, not the Great Lakes program office. So we put the industry activities near the bottom because we are not as concerned with those being focused on health. So we have these areas of concern that are in the process of being addressed, and with the idea that removing impairments will benefit the community. We don't actually have many empirical studies to demonstrate this, and we don't have these synthesis documents, so assessments or even systematic reviews about impairment removal benefit. So we decided to address that. And the goal was to do the synthesis of research on impairment removal benefit. One of the things we found in doing this is that there's really not enough to do a synthesis of that. So sometimes we go back to what is the health outcome that is most impacted by this, and did a systematic review of those. So we're doing these literature reviews that are related to these VUIs, and to characterize how many health outcomes we might see and how impacted they are, with the idea that then we can go backwards and say, okay, so these things are impacted, and if we fix this, then it should improve, and maybe we can design studies to look at that in the future. So our first review was focused on degradation of aesthetics. That is the link to it if you want to go read it. We only found about 19 papers, and some of this was because we were specifically looking for mentions of aesthetics. There are a lot of papers on green space and health outcomes. Just so many. Many of them are focused on proximity, though, and even many of the papers we did end up including still have a focus on proximity. There's a couple that in this 19 papers that looked at beach litter. Amusingly, the people were really more concerned about beach litter impacts on the wildlife than on themselves. And only one explicitly looked at if we take a nature space, in this case, it was a river walk, and make it more accessible, add information to make it more engaging, how does that impact health? So that was like one study was like, yes, the perfect study that we wanted. And we found one. There are many of the studies of blue and green spaces did have some aspect of aesthetics. So one of them looked at bird song, for example, one looked at species diversity, but those don't always link to health when they do that. And when they do, there does seem to be evidence that poor aesthetics have a detrimental effect on health and that people get more improvement from more natural environments. And then this was a sort of offshoot commentary from that review. When my now former postdoc started, she came in at the tail end of us finishing up this review. And so she is a mosquito ecologist by training, and so took the beneficial use impairments and categorized them according to what she thought they would have the most direct impact on in terms of economic, ecologic, public health, or public perception. And then added climate change on top because at the EPA we are very concerned with the impacts of climate change, to look at if aesthetics are degraded, aka there's more litter and more potential places for mosquitoes to breed, or if fish populations are degraded, aka less predators, what could that do to mosquito populations and disease transmissions of West Nile virus and Zika? And how will climate change add on to that? So then our second review is looking at combined sewer overflow and gastrointestinal illness. And this, the grouping of beneficial use impairments that started with this is about harmful algal blooms, warnings to not consume fish or water, and beach closures. And so when we were thinking about doing this and what makes the most sense, one of my colleagues who is a harmful algal bloom expert said, don't do a review just on harmful algal blooms, you'll never finish. So we were thinking about, okay, what's the parent of these things? And what we decided was that combined sewer overflow made a lot of sense. And that also makes sense along the Great Lakes region because a lot of the combined sewer systems tend to be older systems, and they combine both like wastewater and drinking water, whereas more modern separated sewer systems keep those separate. And I think because they tend to be more modern, they also have a little more room for error, rain. It's not error really, it's just more water. And so they do overflow, but they're less likely to do so. And when they do overflow, they are also less likely to contain fecal matter and other effluent from houses. And so we looked at this combined sewer overflows associated with gastrointestinal illness. We had initially searched also on neurological illnesses or diseases and cardiovascular, as we thought all of those could have potential pathways that were reasonable, but we only found gastrointestinal illness in the literature. And again, there's also only 8 studies that actually met our criteria of mentioning combined sewer overflow. There were a lot more that looked at precipitation, either heavy precipitation events or just general precipitation, and even more that looked at seasonal flooding. Those tended to be in less developed countries, which might not even have official sewer systems. So we didn't include them in our actual review. And so this is sort of the summary graphic for the paper. So there's these 8 studies, and we divided them up into what we thought they'd provide, the pathway for which they provided the most evidence. So several looked at recreation, so either swimming, and which that's either through dermal contact or swallowing water. There's a couple studies that looked at picnicking. One in particular looked at an outbreak after an outbreak of gastrointestinal illness, and found that most of the children that were identified as cases had spent time in this valley that had recently been flooded, and they thought that the children picnicking and interacting with the mud, which was still contaminated, and probably sticking their fingers in their mouths because that's what little kids do, and ingesting some of the dirt that had the results of the sewage overflow led to a lot of GI illness. And then 3 of the studies also looked at the potential for contaminated drinking water. So they looked at public water systems and being on systems that either experienced a CSO or didn't, or they looked at heavy rain and different, like separated systems versus combined sewer systems. We also have a theorized pathway of aerosolized pathogens, but no studies have provided evidence of that. And I will say, so this is sort of important, like it's not sort of, we are expecting with climate change impacts more heavy precipitation events, which means there's going to be more of these sewage overflows, and not just in the combined systems, but also in the separated systems, which can have health impacts as well. And so being aware that these impacts happen and being able to use this as evidence, as reasons to address it, has a potential public health impact. And yeah. So then this is sort of one of my bread and butter topics, birth outcomes epidemiology. I really like data analysis. I do a lot of systematic reviews, but they're not fun. They're just really useful. But I like data analysis a little better. So these are 3 studies that are broadly looking at potentially hazardous sites and birth outcomes. So these are the contaminated sites or potentially contaminated sites before remediation. And we have about 1.5 million live births from the North Carolina Birth Registry, and cases of preterm births, term low birth weight, and birth defects among those. So that's the population which all of these studies were done on. So then this is a map of these different hazardous sites that were analyzed looking at low term birth weight and preterm birth. And so this is landfills, which can contain a variety of stuff. Superfund sites, which are, as I mentioned, the highly contaminated with known dangerous toxins. And then industrial facilities, which are typically, they're just normal industrial facilities, but they are emitting some level of pollution through air, land, or water, and they are recorded in EPA systems. And so they looked at residents at birth within 1 mile of a site, and also stratified by type of sites, what type of route the pollutants were being emitted from, and sites containing specific toxic priority substances of arsenic, benzene, cadmium, lead, mercury, PAHs, PCBs, or vinyl chlorides. And in general, there was increased risk of preterm birth and low birth weight with proximity to these types of sites. And the effect was stronger in the sites that had arsenic, benzene, lead, and mercury specifically. And then we have 2 studies of brownfields and birth defects. And brownfields are sites that they might be contaminated. They're usually at least dilapidated. Sometimes it's not really known if they're contaminated or not. They can be like old gas stations or old warehouse buildings where things were done there that we would suspect contamination to have occurred, but it hasn't necessarily been tested, and it's not enough of a priority to make it onto the national priority list or Superfund list. But there are a lot of these around the country, and you have probably seen them even if you didn't realize it. And so these studies looked at proximity. The first one looked at proximity to any type of brownfield and birth defects. And there are a lot, like that's a range of different uses that they might have been or potential contamination. So it's a pretty broad category. And then the second one focused in on the sites that were potentially lead contaminated. And they're potentially lead contaminated because they were tested for having lead contamination, but we don't always have the results of those tests. So we think there was lead contamination in these sites, but we're not 100% sure. So that's just a caveat about the exposure for these. And so this is a heat map of the births, as well as the brownfield sites in North Carolina. And in this, we observed elevated, positive odds ratios, higher risk of birth defects for cardiovascular and external defects, so heart defects and limb defects. And there was some evidence, our power got a little low at this point, but we saw some evidence for if you live near multiple sites, the effect was a little stronger. And this is, again, essentially the same map, but with only the potential lead contaminated brownfield sites. So you can see there's a lot fewer of those. And the results for this were similar with stronger magnitudes, and also central nervous system defects had an elevated odds ratios with proximity to these sites. And recently there was also a systematic review of the literature on brownfields and land and health, and they had 6 studies. So I was like, oh, there's a theme. When we do this sort of systematic review, you'll get a handful of studies. So there's not, this is an area that there's not a lot of information out there in the research world. And then moving on to a more positive exposure, we've also looked at greenspace or greenery metrics and these birth outcomes. In this case, a lot of the studies of greenspace use the NDVI, and so it's just this big 30-meter pixel of is green and how green is it? And that's your exposure, so it's not super refined. There's not a whole lot of detail beyond there is greenery or there is not. So in this case, we used different data sources. So we're able to look at herbaceous cover, tree cover, and aggregate cover, which is both of those together, as well as different types of buffers. So a circular buffer around residents, as well as the buffers around walkable roads near residences, and just generally along roads. And these are just the different exposure maps. I like to include pictures just to have something visually interesting in the presentation. So these are the percent tree cover near buffering busy roadways. And then these are the foundational data that we used for the other types of buffers, including So one of the reasons that we were able to look at these very specific types of greenery and very small buffer sizes was that we were using this 1 meter data for parts of North Carolina. So Durham and Raleigh have this more more resolved spatial data on greenery. And this analysis, we saw that there was modest but consistent reductions in risk of preterm birth and low birth weight with increased levels of greenery, although it varied by type of greenery. So tree cover tended to have a little more consistently across the different buffers that we were looking at, though herbaceous cover was also associated with some reduction in risk of preterm birth and low birth weight. There was also differences by racial group. So most of the benefits were seen among non-Hispanic white parents, whereas the non-Hispanic Black parents, the circular aggregate greenery was, greenway density, which is these walkable roads, or green space around walkable roads, was actually associated with an increased odds of term low birth weight. So there's definitely some other factors that are interacting with this to influence health. All right, now we have the community greening project. I wasn't on this project, but it is important for the next steps of what we're doing. So this is, I stole most of these slides from my colleague who was leading the project. He's much better at slides than I am. So there's a lot of attention on greening neighborhoods and like making cities greener and healthier. Green is good. And we think we agree with that generally. Like there's certain caveats for some things, like maybe don't put things that produce billions of pollen particles, because living in North Carolina, I know that's a fun part of March that we get every year. But in general, greener spaces are thought of as healthier. And so there is the Sun Valley neighborhood in Colorado is a 45-acre neighborhood with a high proportion of public housing. It's generally the residents are lower income, low education. There is a median age of 17, which means most of the residents are children, and there's a lot of single parent households in this area. It was selected as one of EPA's Making a Visible Difference communities, and has had from the state was also selected as a greening project, improvement project, and so had a lot of money invested into it so that they could improve the community. And this was seen as an opportunity to study community at its baseline during the revitalization and after the revitalization. So this accountability type research. And the goals of the specific project were to increase access to community gardens, increase the general green space and recreational space, as well as tree cover, and along with those things, add activity and safety improvements. And I'm not going to go through all the pieces of this, but this is the conceptual model for how these ecosystem services could benefit health. So we have here's the improvements that are being planned. Here's what will change in the ecosystem service, and here's what we think the health outcomes will be. And as you can see, it's complicated. There's a lot going on here. And we don't necessarily have everything on this model. But in general, there's potential improvement for physical fitness. So there's more park, there's more community gardens and play areas. So in theory, people are going to go do more recreational activity, hopefully have improvements in cardiovascular health. Improvements in nutrition, there's community gardens, so people are growing their own vegetables and fruits and eating hopefully fresh fruits and vegetables, and that will improve their diet and things that are associated with that. And improvements in mental and emotional well-being. These park spaces, they're community spaces, so there is opportunity for engagement with other people. Just being in nature has been shown to improve mental health. So that was one of the pathways. And so this is the goal. What is changing and how much? Who is benefiting and how are they benefiting? And what they really found was that, it's not everybody. Some groups aren't getting any benefit at all. And these pathways that we thought, they're not passive. They have to be activated. You have to go out into the space to get the benefit from it. If you're sitting indoors and there's a nice recreational space outdoors, it's not doing anything for your cardiovascular health. And this is part of the reason for that is one of the initial benefits was proposed to be air quality improvement, which, planting trees and shrubs and herbaceous cover can improve air quality. Except this neighborhood is right next to a big highway, and it's a smallish area. They're not covering it with trees. They're improving the green space, planting some trees, and gardening. And so that they're not doing anything to the highway. The traffic pollution is still coming in there, and a few trees are not going to move the needle on that. So that would be a passive benefit. That's not going to happen in this case. We don't have these health benefit pathways that are straightforward or linear. Like, we really would love to have those, but they're just not there. So learning experiences for some of the people on there, and also thoughts about, okay, how can we figure that out? So now we're going to start to move into what are we doing next? So this is, again, a screenshot from the EcoHealth browser. And so we show that there's a lot of inputs to these different diseases in the EcoHealth browser. But probably most people, and realistically, it's more like this, but we're trying to have a tool that's useful for visualization and doesn't make people look at it and immediately shut their browser. So we're not having a spider web up there, but this is probably a more realistic visualization of what's going on. But what most people are going to see is this sort of linear pathway. Oh, urban ecosystems, air quality, cardiovascular disease. And we know it's not that simple. And we think it should look more like this, actually. Not even just these lines, but also these chutes and ladders. This is my colleague who I am working with on this, had developed his theory of chutes and ladders for ecosystems, goods, and services connections to health. And I do think it's a good one and lets you use the game board on your presentation. But essentially, what he means by this is that there are things that help people achieve benefits, and there are things that hinder people from achieving benefits. So these are modifiers and mediators along the pathway. And we don't always know, we think we know what some of those are. Like, for example, safety features might make people more likely to use a park space. Benches, if for accessibility, it being on bus lines, things like that could be helping people to use the park space. Whereas there may be other things like if people in an area are all working multiple jobs, they're not going to have time. So that would be a hindrance. That might be nice for them to walk by the new green space as on their way to their second job, but they're not actually going to be able to recreate in it. So we're getting into the project that we're embarking on, which is, I've been calling it the benefit outcomes pathways. And what we really want to do is elucidate and enumerate the modifiers and mediators between these ecosystems, goods, and services and human health outcomes, and identify the services that enhance or reduce people's abilities to get those benefits. And that will allow us to inform local governments and our regional partners and program offices about activities that might be better served for these types of projects in the future. And so there are people who have been thinking about this already. So here are some publications that, the oldest one is from 2013, so it's not a new thought. And you can see they each have conceptual models, and I'm not going to go through all of them again, but just people are thinking about this. It's like, oh, here's different conceptual models. Oh, they're getting a little more complicated. I do think it's funny. The oldest one is the most complicated one, but they're still somewhat straightforward. They don't always have the pieces that we need. We want to know not just A to B, but what's on the arrow in between. So A1 through 10. So we are hoping to head towards somewhere like this, where we have multiple pathways that can impact health. And we can kind of figure out, so these are the A to B to C connections. And then it's like, okay, these are positive pathways and negative pathways, or pathways that are more likely to respond to intervention than others. And then we have, this is just kids on the pathways. And then we have also these modifiers and mediators. So these, we can add ladders and take away chutes to make these benefits more likely to be achievable, which EPA is a public health organization. That is our goal. And so hopefully that is something we will get to do as we go on, and also to give, inform other governments and our partners about like what are the activities that are actually helpful versus things that people are like, yes, that sounds like a good idea. And we're like, well, there's no evidence for that. And we don't actually know if it does anything or if it just makes you feel good. Like you as a researcher or person that feel good, not the people who are actually you're trying to benefit. So what are we going to do to get there? We're going to do more review studies. Hooray. So again, part of my job as a government scientist is to do syntheses of existing literature so that we can take what is already out there and make better informed decisions and better informed policies. There are, Sun Valley is not the only type of this project of its type. So there's other projects. There's a project in Sandy Joe, Indiana, where a former Superfund site has been capped and is essentially an empty field and has been an empty field for about 20 years. No one uses the space. So they have been having community meetings about how people feel about it and what they would like to see, and some project plans and like getting people's perceptions on the community perceptions on those. So we can take information from that and those community meetings and use it to inform our thoughts about the mediators and modifiers. Like people are saying, oh, well, if you do this, then no one's going to use it. That is important information. And we're also hoping to do some epi studies and work towards efforts that can combine these data streams to better support these knowledge on these pathways and effective interventions. All right, whew, that's it. That's the end. Clearly, I am not the only one doing all this work. There's a lot of people who have been working alongside me, colleagues at the EPA, as well as students and fellows. And so I'm just gonna leave them up there. And yeah, and that is me and my presentation. So if there's any questions, I'd be happy to take them.
Thank you so much. What an amazing talk and what really cool research. If people have any questions, now's the time.
I did say when I was putting it together, I was like, this feels like a job talk. It's not meant to be a job talk, but it kind of feels like here's the course of my research and what I plan to do in the future.
So I think we do have a question. Carol, do you want to unmute and ask a question?
Thank you so much. This was so interesting. I was like furiously writing notes. Do you have any sense, either from this work or just from generally your lit review, with the study with the greening sort of communities and the birth defect outcomes that you saw, if it was more closely related to like air quality or heat mitigation, or just can you speak a little bit just about your thoughts about
Oh, yeah, that's so I didn't talk about any of the thoughts we had about why we saw what you're saying. That is a good question. So these are all in North Carolina. And one of the things about North Carolina, and we've done some studies of like climate related factors, including heat and air pollution. With air pollution, we actually there are associations with a variety of air pollution. A lot of them go away after 2010 when a lot of controls were put into place on power plant combustion. So we were looking at that and we're like, well, that's neat. But also, that means our data is just weird now. So that was fun. And when we look at temperature effects, there have been some people, not in my group, but I think there's some researchers from Duke University who have seen them with like low temperature at night when that stays high. When we have looked at like extreme heat events, we don't see any associations with that. And we think it's my personal opinion, and I don't have any documentation for this. It's just a feeling, and having lived in North Carolina for almost 20 years, everyone has air conditioning. When it's hot out, we don't go outside. So sort of the self-intervention of staying in the air-conditioned areas, unless it's like you have to, no choice, and so you're removing yourself from that exposure. So I'm not totally sure. So we think a lot of the green space benefit is probably stress reduction, mental health benefit. Pregnancy it's stressful. There's especially the poor pregnant people get bombarded with things about like, do this for your baby. Oh my God, you're doing things wrong. So I think possibly just the general like mental health and well-being benefits that are sort of conveyed by natural spaces might actually be counteracting some of the stress. But there could also be air quality related impacts, or cooling impacts. Like there is a lot of tree cover. We do have lots of trees in this area in North Carolina as a whole, and these areas we studied. So it could be cooling, but we don't have specific mechanistic pathways. And that is, I think, generally true of this sort of literature, where because we're using these like broad metrics, and the type of metric we used has only just started, and not everyone is, a lot of people are still using NDVI, despite all the geographers I know going, oh, when people mention it. It is really funny to mention the NDVI to health geographers, because they all had the sort of same, like, I don't like it reaction. There's also the brownfields actually had a similar thought process. It's like, okay, is it contamination that's doing this, or is it just you live near an old gas station and it makes you kind of sad? And we know like that can impact your health. Just having things that are just like oh, I don't like that, can make your health a little worse. So there might be contamination effects. There might also just be like space and your built environment, and that affecting your health and well-being. So very complicated non-answer there.
Oh, thank you. So I think also clearly that means it was a great question. Any either follow-ups or other questions for Kristen? All right. I think that means clearly you've just answered everyone's even anticipatory questions. So no.
Or they'll think of them much later on, which is what I usually do.
Never a bad thing to spark something haunting that just pops up in someone's subconscious later and be like, oh, right, that. So awesome. So if we could please just give another virtual round of applause to Dr. Rappazzo, and thank you so much for coming and sharing this with us. It's really awesome, and we're excited to add it to our recordings of these lectures. Thank you.
Thank you for having me.